A very warm welcome to the YouTube subscribers of the Department of Public Health Dentistry, Chettinad Dental College and Research Institute. Here I am Dr. H. Cyril Benedict to walk you through the basics of epidemiology, the most important basic chapter in epidemiological study designs. So to begin with, what is an epidemiology? It is the study of the distribution and determinants of any health related events. Okay, it is any kind of health related events. It could be a disease, it could be an epidemic, or it could be a vaccination trial or whatsoever. Distribution and determinants of health related states and events in defined populations and the application of this knowledge to the control of health problems in the population. So, you read about the distribution and determinants of health related events in a target population, and you apply this principles to the control of disease in the same problems. In the same population. So basically, there are only two types of epidemiological study designs, guys. That is, you just either plainly observe and describe what is happening related to a particular disease. That is called as observational epidemiology, and you do something about it. You intervene something about it, and you try to control it, or you try to curb it, or you try to modify the course of the natural occurrence of the disease or any other event. That is called as experimental epidemiology. To sum up, in an observational design, you do not do anything. You just sit and observe. You try to make inferences from what is happening in a disease or a health related event. Whereas an experimental design, you do something to control or curb the disease to modify the course of the disease. Coming to observational design, it is the most basic step in epidemiology, and it is actually the first step in epidemiology because imagine when a new disease, a new epidemic happens, we do not know anything about the disease. We just observe what is happening, whom it is affecting, why it is affecting, what it is affecting, where it is affecting, and what are all the risk factors kind of things, right? Imagine COVID back in 2020, the early months of 2020. So when you just observe what is happening regarding a disease, it is called as an observational epidemiology. This observational epidemiology is basically classified into two types, that is descriptive and analytical. In descriptive epidemiology, you ask these basic questions like, what is the disease? Why is the disease happening? On whom is the disease happening? When is the disease happening? How it is occurring? Okay, and where it is occurring. So imagine there is a new disease, and when you're trying to ask these basic questions, you actually answer something called as a descriptive epidemiology. You do something called as descriptive epidemiology when you try to ask these questions to a new epidemic or to a new disease, and you try to find out answers for this. So this descriptive epidemiology is usually the first step. Okay, this is, I told you that observational epidemiology is the first step, and since there are two steps, two basic types in observational epidemiology, this comes as the number one type, this descriptive epidemiology. What? Asking such questions like what, why, whom, when, how, and where. When you are basically asking these questions, you do inherently something called as a descriptive epidemiology. And this descriptive epidemiology is the first step in in an epidemiological design or in any management of a health related mega event like a COVID. And Next comes analytical epidemiology. In analytical epidemiology, we try to draw some meaningful conclusions, or some meaningful inferences about the disease. We try to infer something about something more than what we just did in a descriptive epidemiology. For example, we try to infer about the gender specificity of the disease, the specificity of mortality, the age specificity of the occurrence of the disease, or the mortality or the morbidity, the location specificity, the whether it is attributed to any other socio-demographic factors. We try to draw some meaningful conclusions. For some people, it occurs in a more numbers than compared to others. For example, COVID killed more people who are extremely moribund or morbid due to any systemic illnesses. It did not kill those who are having systemic diseases but were healthy. It killed only those who are completely susceptible to morbid conditions after having systemic diseases. So you do observe in a descriptive epidemiology design, but then you do not just sit by making some observations. You do some inferences, right? So when you do some inference, when you conclude something, okay, when you conclude something, it is called as an analytical epidemiology. So basically, guys, both this descriptive and analytical epidemiology mean the same. They do just observe. But what is the difference between them? The main difference between them is in descriptive epidemiology, there is no comparison. Whereas in analytical epidemiology, we do compare. We do compare between gender, we do compare between ethnicity, we do compare between age groups, we do compare between whatever ways possible are available to us. Okay. So we have seen what is called as descriptive epidemiology and we have seen what is called as analytical epidemiology. This analytical epidemiology is further classified into multiple study designs called as cross-sectional. Next is a case control. The third being cohort. Actually, there is something called as a fourth, okay. But the ecological study design is the weakest study design that gives the weakest evidence. So we usually do not comment on it. We usually comment only on the first three that has the moderate to the strong evidence being given from an analytical study design. So basically, there are four types. Ecological design in an analytical study being the weakest. Then the strength rises from this to here. Cross-sectional study, there is a mild evidence. Case control, somewhat moderate evidence. And cohort study, somewhat of a strong evidence. See, these are just mnemonics that we prefer. Okay, there is no golden hard and fast rule that case control study gives only moderate evidence, which is less than cohort study. There is nothing like that, but it is the usual way. It is the usual level of evidence that is being observed. Okay, so coming to the final thing, that is experimental study design in an epidemiology. See, in an epidemiology, we saw something called as observational. Observational being divided into two types. And similarly, we are next now coming to experimental study design. This experimental study design is also divided into two types. But first, we have to see what is an experimental design, right? I remember I told you that you do not just sit and observe a study design, I mean, a health related event. You do something about it, you intervene it, you modify, you try to modify it. That is called as an experimental study design. In experimental study design, you give something to one group, you withheld something from another group, or You give one form of new treatment, a novel treatment to curb the disease in one group. You give the standard treatment in another group, or you do not treat one group only and you try to treat one another group. Though the last thing that I said is not ethical anymore or not followed anymore. Basically, you do something, okay? So, in an experimental study design, there are basically two types, that is randomized and non-randomized. So considering that there are setting up a basic example that there are two groups, okay? One group receiving standard therapy, standard or a gold standard therapy, and another disease group receiving a new therapy. So whose onus is it to allocate patient to either of the groups? This question is answered by something called as randomization. If you do not allocate them to any of the group, if they are allocated randomly, then it is called as a randomized clinical trial or a randomized controlled trial. Okay, the first and the most important and the most popular and the most evidence-based design is randomized controlled design. That is, it is the pattern to allocate the patients to either of the disease groups happens randomly and you do not influence it. This is called as a randomized controlled or a randomized clinical trial. When you do not randomize it, or when there is no need to randomization, or when there are special technique cases where randomization cannot logically happen. Okay, you allocate patients naturally to one of the groups. Okay, there is no possibility for randomization, or there is no requisite for randomization, or it is unethical to randomize. So in such cases you do not randomize into any of the groups. One group will be definitely getting the standard therapy, another group will only get the new therapy default. So such is called as a non-randomized design. Non-randomized design is also called as a quasi experimental design, okay? But I need to say that when and when ever possible, we must do only or follow only a randomized controlled trial or randomized design, because randomization is also called as heart of a clinical trial, guys. So we have just seen the very basics of the types of epidemiological designs. In further videos, we will be dwelling deep into the subtypes of observational study and subtype of experimental study designs. Thank you.